Hi, and welcome to our first Ask Me Anything with our panel of health coaches. For those of you who don't know me, I'm Nick, Community Manager and one of the health coaches here at Juniper. Before we get started, I just wanted to say a big thank you to all of our patients who submitted questions. It is our absolute pleasure to address any and all questions you have around diet, nutrition, and weight management. Our goal here is to broaden and enrich the conversation between coach, patient, and our online community. So with that, let's get started.
Weight gain is a huge issue for us, even when we are trying to manage our weight. And many of us have discovered that semaglutide has been the only way we've been able to successfully manage our BMI and reduce the health issues associated with obesity. So first and foremost, the most important thing is that you're on the right medication to regulate your thyroid hormones. So if you're not already taking medication, I do recommend speaking to your GP about this to help you level out your hormones and balance these first. Your doctor should be able to prescribe you with a daily hormone tablet to raise your thyroxine levels. The best hypothyroidism diet is one that is varied and balanced. So there are no specific foods or dietary supplements that are helpful in treating thyroid disorders. Simply follow the NHS dietary guidelines. Follow a regular meal pattern with 3 meals and 2 to 3 snacks. Eat 5 fruit and vegetables per day. Base your meals on high fiber starchy foods like potatoes, rice or pasta. Include some dairy or dairy alternatives. Eat some beans, pulses, fish, eggs, meat and other protein sources. Choose unsaturated oils and spreads and eat them in small amounts. And drink plenty of fluids, about 6 to 8 glasses daily. Note that calcium should be included as part of a balanced diet, but some foods that are high in calcium can interfere with your levothyroxine absorption. So it's best to wait a few hours after this before having your medication.
Several factors can contribute to variations in appetite and the ability to follow an eating plan. Your prior water intake can influence your hunger levels. Dehydration can sometimes be mistaken for hunger, so make sure to stay adequately hydrated throughout the day to help control your appetite. Your physical activity levels can also affect your metabolism and appetite. On days when you are more active, you may find you will feel more hungry as your body tries to meet higher energy requirements by consuming more food. Psychological factors such as stress can hugely impact our eating habits. Stress triggers the release of cortisol, a hormone that may increase appetite and cravings. Factors such as your menstrual cycle and sleep can also influence certain hormone levels, leading to fluctuations in your appetite. To manage this, you can try keeping a food and mood diary, which may allow you to identify patterns and factors that contribute to variations in your appetite. Then you can begin making adjustments to your lifestyle, such as managing your stress levels, getting 7 to 9 hours sleep a night, consuming around 25 to 30 grams of protein per meal, and eating 3 meals a day with a snack in between.
We typically recommend that members aim to consume about 1.2 to 1.6 grams of protein per kg of body weight. This usually translates to about 25 to 30 grams of protein per meal. A simple way to achieve this is to aim for 25 to 30 grams of protein with each meal, while also ensuring that the meal is calorie controlled with the goal of 450 calories or less.
The Juniper program is great for helping people who have joint problems, as weight loss improves both the symptoms of joint pain as well as the longer-term prospects for diseases like osteoarthritis. Hip replacement surgery involves a general anesthetic. Some anaesthetists advise patients to stop treatment with semaglutide or other GLP-1 drugs at least 7 days before a general anesthetic, because the effect of semaglutide on delaying stomach emptying can cause problems during the surgery. An example of this could be aspiration of stomach contents despite having been nil by mouth for the usually required period. In the United States, this is now standard advice for general anesthetic procedures. We advise that you discuss this with your anaesthetist or surgical team at the earliest opportunity and follow their advice for your particular case carefully.
So we usually advise to follow the pose technique and mindfulness. So the first step is to identify what emotion am I actually experiencing. Am I tired, stressed, bored, or something else? Once we have identified the emotion we're feeling, we then should check with ourselves. Why am I feeling this way? Am I getting enough sleep? Am I taking on too much work? Am I spending enough time doing nice things for myself? Finally then, we need to think, what else can I do to deal with that emotion that is separate from food? For example, if we're feeling stressed, what can you do to support your mental health? For example, going for a walk, going outside to spend time in nature, speak with a family member or a friend that you haven't spoken with for a while. Or also practicing some self-care, like a bubble bath or dancing. So instead of trying to avoid this altogether, it can help to think about alternative comfort. Think of it as a toolkit for yourself. And food can be part of it, but it doesn't need to be the only one.
This is a really great question. The truth is, it's much harder to build muscle or achieve hypertrophy while in a calorie deficit, but it's not impossible. For those living with overweight or obesity, studies have shown that building lean muscle is possible while in a calorie deficit. It's more possible for those, however, who are living with overweight and obesity because they have a larger endogenous supply of energy. It's also much more common for those people who have never engaged in resistance training before, so muscular hypertrophy comes more natural to them because their body is doing something new. However, I do encourage you while on our program to focus on maintaining lean muscle mass and preventing atrophy or the loss of muscle rather than hypertrophy.
Sports scientists have defined 6 zones to talk about exercise of varying intensity. These zones are categorized by the percentage of your maximum heart rate reached during the exercise. Zone 2 is characterized by being at 65 to 75% of your max heart rate during training. Examples of this may be a slow jog or cycle or a walk with an incline. For reference, when you're training in Zone 2, you can still maintain a conversation without getting too out of breath. Exercising in Zone 2 is beneficial for fat loss, as within this zone, your body uses fat as its energy source, as opposed to carbohydrates. When you train in higher zones, your body tends to use carbohydrates instead. This is part of the reason why it can feel more uncomfortable training in higher zones.
A high-quality protein, also referred to as a complete protein, contains all the essential amino acids that the human body needs in the right proportions to function properly. These amino acids are not produced by the body and must be obtained through the diet. Animal-based sources like meat are considered high-quality proteins as they contain all the essential amino acids in adequate amounts. However, for vegetarians, it can be challenging to ensure they consume enough high-quality protein since many plant-based protein sources are deficient in one or more essential amino acids. Only a few plant-based proteins are complete, consisting of eggs, soy, quinoa, and buckwheat. However, by combining different plant-based protein sources, vegetarians can still obtain high-quality protein. For instance, combining a legume, such as lentils, with a grain, such as rice, can create a complete protein source. The amino acids are missing in one source are usually actually present in the other.
While all macronutrients play a role in both weight loss as well as a healthy diet in general, evidence shows that protein plays an important role in both weight loss as well as weight maintenance long term. Protein is resistant to digestion due to its complex structure, making it slower to digest. Once eaten, it leads to an increase in our fullness hormones and a decrease in our hunger hormones, such as ghrelin, the combined effect being increased feelings of fullness, which helps us manage our appetite. Protein helps increase the amount of energy we expend, as the body burns more energy in the digestion and absorption of protein than it does for other macronutrients, such as your carbohydrates and fat. Eating enough protein also helps to maintain our lean body mass as we lose weight, which helps us burn more calories at rest. Overall, protein helps us reduce the amount of energy we are consuming through food, as well as increase the energy we are burning or expending, helping us achieve the calorie deficit needed for weight loss.
When we lose weight, we lose a combination of lean body mass, water and fat mass. It's normal to lose lean body mass during any type of weight loss intervention, but too much muscle mass can be a problem. It can have a negative health implication, for example, increased fatigue, lower metabolism and increased risk of injuries. Lean body mass is also more metabolically active, that will help to burn more calories. The more weight a person loses during a short period of time, the more muscle mass they will lose in addition to fat. On GLP-1, a quicker weight loss rate is common, so it's important we focus on maintaining lean body mass throughout the program. Some ways to minimize the lean body mass losses is to ensure you're consuming enough protein with your meals and throughout the day, and exercise, so specifically resistance training.
And there you have it. Thanks again to all patients who submitted questions. There may be more opportunities to ask questions, and that opportunity may be right now. Post a new question or follow-up to one of the answers in this video. Remember to tag a health coach and we'll be sure to answer it ASAP. Until then, Merry Christmas from the team and have a Happy New Year.